You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. On today's show, we are talking about root cause dentistry with a focus on the relationship between our oral health and sleep-disordered breathing. And we are doing so with our guest, Dr. Ingo Mahn. Dr. Mahn is a trailblazer in the field of dentistry and is based in Phoenix, Arizona. Dr. Mahn grew up in Germany and moved to the United States at the age of 12. He graduated from Marquette University in 1985 after attending there for both undergrad and dental school. An early adapter of biological technology, Dr. Mahn was one of the first users of Cerec in 1995. After discovering the benefits of a more natural approach, he founded Integrative Dental Solutions in 2001 and went on to earn a doctorate in Integrative Medicine from Capital University in Georgetown in 2004. In 2017, Dr. Mahn and his family relocated to Phoenix, Arizona, where he founded Natural Dental Partners, a biological dentistry practice. Aside from running his dental practice, Dr. Mahn currently spends most of his time focused on treating the root cause of breathing disorders, sleeping conditions, and TMJ dysfunction. He founded the Institute for Advanced Airway Studies to empower fellow dentists to establish superior airway programs in their practices for enhanced patient well-being. Dr. Mahn is also an accredited member of the International Academy of Oral Medicine and Toxicology, where he serves as a board member and chairman of the Ozone Committee. As mentioned, we are going to be talking about sleep-disordered breathing, what it is, how both sleeping and breathing are linked to the area of dentistry, and common signs of sleep-disordered breathing. Stay tuned. We will be back in just a few minutes to speak with Dr. Mahn.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub, everybody. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on those locations. Dr. Mahn, welcome to the show.
Thanks for having me on.
I'm sorry, I caught you in the middle of your water drink. That was not very professional of me. I apologize. Holistic dentistry, I go to a holistic dentist. I can't say enough about the policies, procedures, what they do there. So let's revisit. Well, let's first talk about how did you get into the field of dentistry? And then maybe tell us how that kind of broadened out into biological dentistry.
Yeah, so it was interesting. I kind of, for some reason, already knew in ninth grade that I wanted to go into dentistry. And a big part of it had to do is I was like the science, but I also was kind of inspired by my grandfather. I grew up in Germany with him, and he was an artist, and he would always carve all these little figurines. And he was just this very creative guy. And I always wanted to find something that combined science and art. So I thought, well, dentistry might be kind of interesting. And of course, at the time, I had no idea what dentistry would evolve into. This was literally probably in the mid 70s when we weren't even talking about all of the cosmetic dentistry and all of the things that, we would eventually do. And so once I graduated from dental school, I was just one of those, doctors that always wanted to learn more and find a better way to do things. And so I was always going to these continuing education courses, learning about new techniques and pieces of equipment. And once I learned about it, it's like, okay, if there's a better way to do it, I have to do it that way in my practice. And then in the late 90s, I kind of got into more of the cosmetic dentistry. So I stopped doing the metal fillings and the metal crowns, not so much for health reasons, but more because I liked the appearance and I thought the materials were better. I already knew there was, definitely some issues with mercury. And so I kind of got this reputation as, hey, this guy will take out your old amalgams and do a decent job of putting in these white fillings. And so all of a sudden I started getting all of these patients that brought me, pamphlets from Hal Huggins and the IAOMT and all of these holistic dental associations. And, I was always open-minded, and I looked at it and go, hey, this makes a lot of sense. And before I knew it, I was a holistic dentist.
Well, so what made sense to you? You went from cosmetic surgery into holistic dentistry. What part of it made sense to you?
Well, just, when you look at the dental amalgams, for example, they're 55% mercury. They're very weak. They do a lot of damage to the teeth, and they don't actually bond and strengthen the teeth. So you look at these things and they're ugly, they're weak, and they're destructive, and they're toxic. Like, okay,
doesn't take much to make the jump.
No, 3 strikes and you're out, and you're already at 4 years. So I just like the fact that these other materials actually strengthen the teeth and were also aesthetically pleasing. Mm-hmm. So that kind of just started this whole wave of people coming. And then as I got into it more and more, I realized I was learning so much. I mean, the patients that were seeking out holistic dentists back in the, this was, around 2001, they were very well educated. So I learned a lot from my patients, and they were talking about a lot of things that I didn't even understand. And so that made me do a doctorate of integrative medicine program out in Georgetown back in 2003 and 2004. And that wasn't so I could practice it. It was really just so that I would understand my patients. I was working a lot with practitioners now that were sending me their patients. So I figured the more I knew about the big picture, the more beneficial it would be for my patients.
So when we're looking at the area of biological dentistry or holistic dentistry, I don't know if you equate them as the same. What are the stark differences? The amalgams, yes, but also treatment technique. What else differentiates the medical conventional path of dentistry from what you're practicing in the biological space?
Well, it really is just understanding how the mouth impacts the overall health of the body. I mean, you look at everything from the toxic metals. You look at when there's even a combination of metals like, the fillings and crowns that create electrical currents. When you look at root canals, the toxicity that can be associated with infected root canals can affect the entire health of a patient. Even gum disease. That was kind of one of the things that's opened the door in conventional dentistry to, feeling like we're a little bit more than just, molar mechanics, understanding that, hey, people who have gum disease, this affects their cardiovascular health. This can lead to diabetes. And women, it can lead to, low weight babies. So that started, those are all of the things that kind of differentiate us. But it's kind of cool that as, now dentists are saying things that if I would have said them 20 years ago, I would have been, ostracized, which we as holistic dentists kind of were. I mean, we were basically told we're crazy. And now, they're saying exactly what we were saying 20 years ago in the biological dental community. Because the science, I come from a family of German engineers. So I like to see data and information. And to me, it wasn't about, I'm going to do this way just because it's always been done that way. I'm always looking at it, well, does this make sense? And does the science, bear out the procedures that we're doing? And I felt like the holistic dentistry was actually much more science-based versus like, well, that's just the way we've always been doing it.
Yet I recall my mom, I think it was my dad, a family member, who had a heart issue. And the dentist back then said that she had to take antibiotics before she came to a dental visit. So there must have been some recognition of the, I don't know, do you call it the vascularity of the mouth that they were dealing with? That there's a connection between the mouth. At that point,
Yeah,
at least the heart, but now we know systemically.
exactly. And that's been something we've looked at for a while, because especially when you're doing cleanings, you're scraping, say, below the gum line, you introduce bacteria into the bloodstream. And if you have a problem with, say, a valve or some kind of already a slight blockage, those bacteria can accumulate there. And you think about it, isn't it funny that we call it plaque in the mouth, and it's also called plaque in the arteries? They're now using like genetic type testing to show that those organisms in the bloodstream actually do originate from the oral cavity. So there's definitely a connection there.
And then, 10, 15 years ago, the boom that is still going on with the microbiome, the gut microbiome, and now the oral biome. All of us who are in nutrition, I shouldn't say all of us, but most of us in nutrition who are doing integrative care with their clients and patients, this is a staple now, talking about the oral biome. How does that come into play with what you're dealing with, or is that something that you focus on at all?
We do, we in our practice we already get patients that are, for the most part, really familiar with these types of things, which is why they're seeking, the name of my practice is called Natural Dental Partners. So I do tend to attract a more health conscious crowd, but we do we do check for, there are some tests we do to, especially if we see problems where they have, periodontal or, gum issues or a lot of decay. We look at like, okay, could dysbiosis be part of the root cause of that, along with other things that we look at, like, pH and nitric oxide. We test patients for nitric oxide levels. Are they mouth breathers? So it's all part of what we look at, because, those all affect the microbiome, which affect, the rest of the health of the mouth.
And the nose connection to the mouth and the rest of the health of the body, all part of it all. Now, do you work with patients who are coming to you that are diseased? And what I mean by that is, are patients referred to you specifically because they have cancer and they need a specific type of treatment? Or is this something that they just gravitate to you? Why is it an exceptional idea for people with cancer or other illnesses to work with someone like you?
Yeah, you're absolutely right. We get a lot of people that have had chronic types of conditions that have, in some cases been failed by the conventional system. In other cases where they've maybe said, hey, I'm already starting to do all of these things, like looking at my nutrition, doing these different therapies, like seeing, craniosacral therapists and all these different things, and I'm still not feeling as well as I could. And when they start doing research into what else could be causing their medical condition or contributing to it, a lot of times now they'll come across, the oral cavity. Hey, do you have a mouthful of amalgams? Do you have infected root canals? And of course, now we're really looking at airway and proper breathing, not so much sleep apnea, which is the end of the road, but sleep disordered breathing. Kind of, we're all on that spectrum of not being ideal, breathers and sleepers. So now we're looking at that as being a huge contributing factor to health, and especially things like cancer, because of course we know, cancer thrives in an oxygen poor environment. So helping people with their breathing properly to facilitate nasal breathing, good oxygen exchange, good nitric oxide production, which, facilitates oxygenation of the tissues, is a really critical component of them doing their other therapies. And if that's neglected, you're really kind of beating your head against the wall sometimes.
So this is one of the areas that you are especially passionate about, is sleep disorder, breathing.
Mm-hmm.
The connection to dentistry, can you bring it all together?
Well, it was kind of funny. I was at a conference here in Arizona. At that time, I was still practicing in Wisconsin. It was completely unrelated to airway, but I had this conversation with this dentist who um, said that he helped his daughter by, fixing her sleeping and breathing. He said she struggled with her weight. She didn't have any friends. She was doing poorly in school, couldn't play sports. And when he addressed those sleeping and breathing issues, that her entire life changed. And that made me start looking at sleep and breathing completely differently. And I started taking all of these courses, going to conferences, and unfortunately, I never introduced any of that into my practice because it was all everything that they were teaching were all band-aid solutions. And I was looking for how do you actually fix the problem. And so I probably spent 7 or 8 years going to all of these different courses and conferences. And I know you've had James Nestor on, who wrote the book Breath. Mm-hmm. And I kind of tell my patients, I was so upset when I read that book. And I said, because I tell them, I say, you mean to tell me that I spent 7 years going to dental conferences and medical conferences, and I read a book written by
could have read the book, yeah.
a journalist, and he wanted to know the why. He's like, not just what's the problem, how do we slap a Band-Aid on it? He wanted to be like, okay, why are we in this position where everybody's, our teeth haven't gotten bigger, our tongues aren't getting bigger. Why are our skulls and our jaws and our airways shrinking? And so he, of course, did a great job of presenting really great research in a very entertaining way. And that's raised a lot of awareness with what I'm doing. And that's actually the appliance that he used, that he speaks about in that book. He went to a dentist named Dr. Ted Belfour in New York. And he talks about how that appliance improved his breathing, his snoring. And so I was fortunate enough to have Ted Belfour as my mentor for a couple of years to kind of teach me about these appliances. And it's completely changed my practice and the health of my patients by being able to provide them with that service.
Well, when James came on, I think it was pretty early on in his book launch. And then about a year later, I heard and saw so many people taping their mouths, to go to sleep at night to try and improve that. It's not quite that simple. People have, other issues to take on before you can get to complete nose breathing. But let's talk about, there was an interesting picture that I saw, and it was the jawline of several highly trained athletes versus the average Joe. Right. And so many highly trained athletes who need to breathe properly have the square jawline. And this was a big part of the evolution of why we're not breathing. Can you tell us what having a proper jawline does to the nasal passages, the sinuses, to accelerate, or not accelerate, but to allow us to breathe properly, and why the corollary of that, why our jaw has narrowed and dropped so?
No, that's a great question, and it's once you start going down this rabbit hole and you start studying this, it's actually a little bit of a curse, because when you're walking around, you start looking at patients. Like facial features. You look at their profiles, you look at their jaws, and it drives my family crazy. Like we're at an airport, I go, look at that guy, like he's an airway patient. But the funny thing is, they're now doing it. They're like, hey, Dad, look at that guy. He doesn't look like he breathes too well. But it comes down to really that in general, our upper jaws, our maxillas are underdeveloped, and that starts literally from the time how we're positioned in the womb to how the baby's delivered to whether or not the baby's breastfed. That's obviously huge. We're really into someone named Weston A. Price. You may have heard of the Weston A. Price Foundation. He studied nutrition and the effect on people's jaws. And he was really focused on nutrition, but it really turns out that the nutrition of the mother's milk is important, but the actual act of breastfeeding is what they call it functional orthopedics. It actually starts all of the development of the airway. And so I know there was a period of time when physicians were telling moms that, hey, bottle feeding is just as good as breastfeeding. And you probably can make, a dumber statement in the medical industry than that, because it really sets up kids for poor health for their entire life when those airways don't start to develop. And then it's really all about our diet. We had a diet that had the consistency of beef jerky, and our diet, once we started cooking foods and microwaving, we've turned literally into two-sided chewers, where instead of, when you bite in a piece of beef jerky and you're biting on one side, you're creating torque in the sphenoid bone that moves all of the cranial bones and stimulates the growth of that maxilla, which is the upper jaw. And once that's underdeveloped, that causes a problem with the lower jaw. So the lower jaw is now retruded and entrapped. And when you look at profiles of kids these days, a lot of times you kind of see them with their jaw is retruded. And that tells you right away, when the jaw's back, that holds the tongue, that's pushing everything into the airway. So it's really, one of my mentors said, airways, it's like the jaws are like ballroom dancing. The upper jaw leads and the lower jaw follows. So the lower jaw, a lot of times what's going on there is determined by that underdeveloped upper jaw. And that's why we end up with the crowded teeth. Kids who have tongue ties, developing improper swallowing patterns. So the tongue isn't functioning the way it's supposed to. So that tongue in your mouth is almost like a little orthodontist that's supposed to go to the roof of your mouth and push out. So if your tongue is not functioning and doing its job, now you have lips and cheeks pushing in, and that's what causes the crowding. And that's the problem with orthodontics, is they straighten out teeth and, unfortunately, in some cases pull teeth, but they're more focused on lining up some teeth versus can this patient actually breathe once we do that. That's, by the way, fortunately changing. There's a lot more dentists now that are doing what's called patient-centered orthodontics, which I guess they now understand that there's a patient attached to those teeth. It's not just about lining up some teeth. But yeah, that's kind of the relationship between the upper jaw and lower jaw. So when I see that jaw, when I see that underdeveloped jaw, I know right away the upper jaw is underdeveloped and there's not enough room for the tongue to sit properly in the mouth to keep it out of the airway.
Okay. Let's take a break here. I want to ask a question that I think may take us too far over our time. So we're going to take a quick break, everybody, and we'll be back in just a couple of minutes to continue our conversation.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to our show. We are having a conversation about the cross-links between breathing, sleeping, and dentistry with Dr. Ingo Mahn. Now, I just want to clarify, Dr. Mahn, before we move on, the last point that we were speaking about. Is it that we're not chewing enough hard food to develop that jaw, or is it too hard foods and we are doing some damage?
No, that's correct. Our diets have gotten softer and softer, and we've literally turned into two-sided chewers, so that you're putting forces evenly. What you really want to do is when you're chewing something hard like beef jerky and you're biting on one side, you're creating like a torque, and there's a big bone called the sphenoid bone that a lot of the other cranial bones are attached to. And so by torquing that, you're really stimulating the growth. And, if you think about it, we have this genetic blueprint for a properly developed, jaw and airway. And as you grow up, your tongue is going to grow to the size that it was kind of programmed to grow to. A lot of the other tissues will. Bone, on the other hand, needs that environmental input, like that strain. You can, in Weston A. Price's book, he shows identical twins. One kind of ate the traditional diet of very hard, firm, good foods. And this was at a time when they were introducing these refined foods and sugars. And their faces, even though they're identical twins, are developed completely different. So we do need that environmental input for our DNA to be expressed properly. And so that's really what we're missing. And that's why we have that discrepancy between jaws and and tongues. And Dr. Felix Liao wrote a book called 6 Foot Tiger, 3 Foot Cage, talking about the 6 foot tiger, the tongue, being in a 3 foot cage. And unfortunately, when you don't have that room, it impacts the airway. So that's kind of what we're seeing with our modern diet.
Okay. Now, let's kind of go full circle here. Dentistry, breathing. What is the impact here when we talk about sleep disorders? How do they all come together?
Yeah, I think the biggest problem is that in this country, when doctors and dentists are looking at sleeping problems, they're looking, are you an apneic patient? When you do a sleep test, is your apnea-hypopnea index bad enough to qualify as sleep apnea? So apnea-hypopnea index refers to how many times an hour do you stop breathing for 10 seconds or more, or your blood oxygen level drops by 3% or more. And because the only solution that we have in medicine is the CPAP, which is not, a very pleasant solution that most people want to use, they literally say, well, if you have a mild problem, they're like, well, the only solution we have is a CPAP. So just come back when the problem gets really bad. So sleep apnea is kind of the end of the road when your body, all the protective mechanisms don't work anymore. And now you're literally depriving your body of oxygen. So on the way to being a sleep apnea patient, we go through different stages, like, something called sleep disorder breathing. And what we're finding is that it's really about how collapsible and how stable the airway is. So when you're standing and your airway's like this, as soon as you go to sleep, you've got a tongue sitting there. Now that airway gets compressed. And that's why it's called obstructive sleep apnea. It's the obstruction is generally by the tongue. And so when your airway collapses like that, things like, for example, if you clench and grind at night, we now know that is not a bite issue, but it's really your body's starting this rhythmic muscle activity to try to keep the airway open. And it does a pretty good job for a while. The problem is when your airway collapses and you start to do that, it puts your body into fight or flight. I mean, imagine being waterboarded by your own tongue. Your body's not going to be in a relaxed state when you're sleeping. So your body creates these, it's called respiratory disturbances. So every time as you're starting out and you're supposed to go into deep sleep, now all of a sudden your airway collapses, you have a disturbance and you pop back up into a light sleep. So that's why you have so many people saying, yeah, I slept 7 hours last night, but I don't feel like I did. I basically call it, it's kind of funny because when we talk about diet, we don't talk about, well, how much food did you eat yesterday? We talk about the quality of the food. And we should really be talking about sleep, not in terms of how many hours of sleep did you get, but how many hours of quality sleep did you get? Because in that light sleep, all those things that are supposed to happen to help your body heal and regenerate are not happening when your body's in that upregulated state.
Yeah, it's a beautiful thing for me to listen to you. I've been impacted by cancer. I had breast cancer. And I work with many people that have cancer. But the many and multitude of vehicles that we can incorporate into our lives to impact our health. You're talking about breathing as activating the sympathetic nervous system, which causes us fight or flight, which causes inflammation. All of these things are common traits in disease.
Yep.
So the more people can understand what you're doing, a top-down effect, the more tools they have for fighting disease. And I think that opens up such broad avenue for hope. I really, really do. I think it's wonderful. Now, is there, for an adult who's an adult, fully developed brain, jaw, everything, can we change the shape of our jaw? Can we change our airway? Is there still hope left for those of us who need it?
Absolutely. And I think that's kind of the problem in medicine and dentistry is they don't think they can move the upper jaw. So everything, all the treatments are focused on the lower jaw, which is just hold the jaw forward in your sleep. But the homeo block that was invented by Dr. Ted Balfour actually does change the shape. And funny enough, that's how the appliance was initially invented. So he was he told me the story about how he had a practice on the Upper East Side of Manhattan, and he would have all of these performing artists that were patients of his. And he goes, sometimes they would want a new headshot or want a couple teeth straightened out. But back in the 80s, we didn't have the Invisalign and these clear aligners. So it was the full braces, which as a performing artist, they did not want to put on in their mouth. And so he said, in New York, you can find anything. And he says, I found this guy had been doing orthodontics for 60 years, who was using these removable appliances to straighten teeth. And so he said, hey, come and show me how you do this. And he started using them on these performing artists. And all of a sudden, these patients would come back and say, hey, my makeup artist is telling me my face is changing, that my jawline is more defined, that I'm growing, my cheekbones are growing. And when I'm singing, I'm hitting higher notes. And so he said, I asked him about it. He's like, yeah, I see that all the time, but I don't care about that. And Dr. Balfour thought, well, I do. This sounds really interesting. And that led him to kind of explore that these are actually epigenetic appliances that replace the missing hard food in the diet. And so when you stimulate the body the way it was meant to be, our DNA is constantly being re-expressed. So he found that our bodies can still change. And we see patients in their 70s and 80s. This is what the appliance looks like. I don't know how well it's going to show up, but there's actually a screw in the middle where, as you're stimulating the body, you turn that screw and the appliance, you can see the expansion happening, and it's not being created by the appliance. So we're not pushing on teeth or the jaw. We're literally just inputting the forces, the body changes and grows. And then with the appliance, we're turning the key to keep up with those changes.
My daughter had something similar to that, but it wasn't removable like yours.
There's different expanders. There's fixed expanders in kids. Now on kids, it's different. Kids have at that point, there's a suture that runs right down the middle of the upper jaw. And that suture is still open in kids, and they put these appliances in. And when they're turning that key, they're actually pushing and creating that expansion. Once you're 10, 12 years old, that suture closes and is locked. So we're not creating that expansion by turning that key. We're only doing that to keep up with the other changes that this appliance is creating.
Interesting. I have 4 children. 3 of them had braces, and the only one who didn't was my daughter, who had this expander. And the reason she started with the expander is she sucked her thumb, and she had like a complete circle when she smiled. She had an O, so they put the expander on. Her teeth dropped in beautifully, and she never needed any other dental work. I just in fact made that connection between what you're talking about, your homeo block, and what she had. Now yours is removable.
Yes.
Is it for all ages, or is this an adult appliance?
We use this on adults. We have started using it on kids younger and younger. As early we do need the first molars to be in. So generally, 12 or 13 years old, we can use this appliance. For the younger kids, because once you start treating airway and sleep and breathing problems, you realize like a lot of these issues in these patients have been going on since literally birth. And so that's one of the focuses of our practice, is to treat kids so they don't have to go through years and years of struggling with these inflammatory type diseases and whatever else, that we can fix them younger. So we use some different programs like Healthy Start and MyoBrace and Tooth Pillow to retrain the muscles, because that's really what it's all about. Like I said, that tongue is like a little orthodontist in there that's pushing out so that you create that proper arch form and width and space for the tongue. And if the tongue is underdeveloped and not functioning properly, the forces from the outside are pushing stronger than the forces pushing out. And that's how you end up with crowding. And that's how you end up with, what happens when kids don't wear their retainers?
Mm-hmm.
The teeth move back. Well, that's all the muscles doing that. And if you retrain the muscles, and Dr. Belfour said, I feel like everybody before they have braces should have to wear this appliance for a year because it's going to create more real estate. And it's going
to
yeah. And then it's going to make the case go faster, and it's going to be more stable because now the tongue is acting as a retainer.
So this is a removable appliance. It is worn at night only, so minimally invasive. Do we need to see you directly to be fitted for this? Because a lot of us can't travel that far.
Well, one of my passions right now is to, once you realize what this can do for people and how much better it is what we're doing in dentistry right now, my mission right now is actually to teach this to as many dentists as I can. And I do have an educational program to teach this to dentists, but it can be done remotely. We have some patients that we have done that for. Now the impressions, you remember it used to be you had to put all that goop in your mouth.
Yeah.
And those weren't particularly always as accurate as we wanted to. And when we inserted appliances, there was always a lot of like grinding and adjusting. Now we're using these digital scanners to create ultra accurate models. And so if we have patients that call from another city, we sometimes will just call a orthodontic office and say, hey, we just need one of these optical scans of their teeth. We need a 3D x-ray. And then we send them and a couple photographs, and then we can send them a sleep image home sleep study ring that they can wear. So we can do an in-home sleep study. And then I compile all of that information because, sleep is a very multifaceted, it's not that you have a sleep issue, I'm going to make you this little appliance and this is like the magic bullet. It's, part of a protocol. We have to look at things like, are there, potentially allergies going on that are preventing someone from breathing properly? Is there a tongue tie? Are there lifestyle factors? Do they maybe need to lose some weight? How's their sleep hygiene? So when you're looking to treat sleep and sleep disordered breathing, it can be a very complex subject, but it's also something we found that most people suffer from very similar things. And when we do the workups, and figure out how to design one of these appliances for them, they do really, really well with it.
And where are you located?
So I'm in North Scottsdale.
Nice place to go.
Yeah. So, if you're someplace where the weather's crummy, just come and visit.
Come and visit. Is it a one-time visit? So, you never know what people would want to do, right? So people make the trip to your office. They see you once. Can everything else be done from a remote perspective?
So generally with patients that are here local, we could get the records from pretty much anyone. Those are pretty standard, the information that we need. It's always nice to see the patient for the actual insertion. So the first time we see the patient, that's probably the one time that I still would really prefer to see them, just because we talk about a lot of other things that we do in conjunction, like, we give them things teach them how to do mouth taping, nasal dilators. We also, in some cases, use a laser procedure called night laze that allows us to help kind of turbocharge the program and tone the soft palate, can sometimes even reduce the size of the tongue. And also we treat the floor of the mouth that helps treat the muscles that support the airway. So we do like to, the ideal situation is that you're able to come here for the insertion appointment and if needed for the laser appointments. But there are ways around that, and we can sometimes find, practitioners in a town that's close to them to work with.
Okay. What do you think needs to be done to raise public awareness about, the importance of sleep disorders, breathing, proper dentistry? What can we do?
I think it's what you're doing. I think, giving me the opportunity to be on your podcast, I'm really grateful to be able to share this information because it's kind of, they say it's the hot topic in dentistry right now, But, to get the word out, it's really, people like you on the podcast, and then, patients that hear about it going to their dentist going, hey, I heard about this. Are you doing something like this? And and I think that's how the word will spread. So I'm appreciative of what you're doing to help get the word out, because, that's really the way to do it.
And if we have actual professional dentists listening to the show, how do they get, how do they become well-versed, similar to you?
Yeah, so I do in-office programs here, and I have a website called My Airway Training. .com is the URL, and I do a one-day course. I try to keep it very simple, because the problem with airway education in this country is it's been really overcomplicated. And my mission has been to, just like almost every dentist does things like Invisalign and the clear aligner orthodontics. So I'm trying to simplify being able to diagnose patients and treatment plan them into a very simple program that's very much along the lines of like, hey, if you're able to do Invisalign, you're able to do this kind of treatment as well.
Very good. Okay. Unfortunately, we've come to the end of our show. That was very quick. Where can people find you? So you gave us your URL for your program, but the best ways to get in touch with you.
So I have two websites. One is for my holistic practice, and which is called Natural Dental Partners, and the web address for that is mynaturaldentist.com. And then I also have a separate website for my airway program, and that's A Breath of Health, and so it's abreathofhealth.com.
Wonderful. Dr. Mahn, it was wonderful having you on the show today. A lot of information and attainable information for us. So thank you very much.
No, you know what? I love sharing this, and it's funny when I'm out and about and I'm talking about this and people overhear me, it really resonates with people. And it's like I almost can't go anywhere. Like anytime I sit at an airport terminal, I end up handing out 2 or 3 cards, because people are like, "Oh my gosh, this makes so much sense."
It actually does, and people becoming more aware. I really do think people are becoming more aware. So wonderful. Thank you again for joining us.
You're welcome. Thanks for having me on.
Everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.